Measles is a highly contagious virus that causes fever, rash, cough, and other complications. It was officially eradicated in the United States in 2000, but because of people not getting their children vaccinated for measles, it has come back and is causing death around Texas and other states. Measles has caused 3 deaths in the Houston area, and people are asking why and how to stop the spread. Dr. J. Reddy is the Chief Science Officer at HealthTrackRx. He is a longtime healthcare and laboratory executive with a decade of experience in molecular diagnostics. Most recently, he has spearheaded HealthTrackRx's response to the reemergence of measles and the growing concern around avian influenza bird flu. His team has launched molecular testing protocols to ensure health providers the ability to quickly identify outbreaks of many infectious diseases. We spoke to him about the spread and where it started.
Well, it was eradicated back in the year 2000, and while we still had cases that popped up in the U.S. from mainly global travel, people who had traveled to countries where vaccines were not as readily available as they were here, it would get to the United States, but it wouldn't spread. What we've seen since that time is really vaccine hesitancy across the board, where our vaccination rates have fallen below the threshold of 95% in a lot of areas. And once you fall below that threshold, the herd immunity that we had in the community is gone. And so when that happens, you're able to get community spread now of measles for people who are in the unvaccinated population. And, a lot of kids can't get vaccinated till a certain age. Like, you usually can't get your first dose of a vaccine until you're between 12 and 18 months, 12 and 18 months old. But that group is really at risk because they can't get the vaccination until that time.
And so it's been spreading. I know we have 3 cases here in Houston, a lot of cases in West Texas. Why are people hesitant about getting vaccinated right now? Because it's been proven that the vaccine works, and
I think it started back in the 2000s or early 2000s with kind of the naturalist movement, where putting anything outside of your body could potentially harm your body. And, there was a little support back in those days. In fact, the paper was published in a pretty reputable journal. It's since been pulled about the potential dangers of vaccination. And so even though that's largely been debunked, it does create a lot of questions for parents in particular who might be worried if a vaccine is going to harm their kids. At the same time, during the COVID pandemic, when we had forced vaccinations, as a country, we generally don't like being told what we have to do or not have to do. So when you combine those two together, we have now kind of a mistrust in the science. We have a mistrust in government pushing down mandates. And I think you combine those two together, we have a portion of the population that's hesitant to get those vaccines and might perceive them as dangerous and causing things like autism or things like that.
Yeah, I've heard in our health, public officials say, well, it may cause autism or it may cause other ailments. How do you? When you have public officials saying this, that kind of puts doubt in parents.
Absolutely, and I think where we're getting kind of dangerous is we lump all vaccines together, right? And we when every vaccine is different for a different purpose, and for different people. And the MMR vaccine has been around for decades, right? And it's been pretty well known. The kind of side effects from that could be a low-grade fever, could be diarrhea, really minor things in comparison to what a measles virus can give into a human. But then we also kind of lump that same thing in of what happened with COVID, where we quickly developed a vaccine, and so we now, because we have hesitancy about the COVID vaccine, now we apply that hesitancy to everything else that's come before it. And I think we're getting to a point where conversations really just need to be opened up, and people need to have the confidence. It's good to have questions. It's okay to have questions, but go to a trusted, your trusted healthcare provider and have those conversations, bring up those concerns, and then hear from them what the data suggests about that vaccine in particular.
You said the naturalist movement, as far as putting stuff in your body, How popular is that?
I wouldn't say it's that popular. And in fact, if you look at it, our global vaccination rates for measles are still above 90% in most areas. So it's not like the majority of the people aren't getting this, but every time you whittle away a percentage or 2 points, below the 95%, that's when we start having the issue of measles being spread endemically in the United States. Where I think so I wouldn't say the naturalist movement's a huge concern, but politics on both sides of the we politicize this point very frequently, but on both sides of the equation, people are hesitant to get vaccines for particular reasons. But I would say on that kind of started back in the early 2000s, where people were looking at kids who had developmental problems or spectrum disorder, and now trying to find a reason why that might have occurred.
How scary is this, the measles outbreak not for the general population, but for a city as large as Houston?
I mean, it's risky. I mean, it is one of the most contagious viruses known. If one person walks into a mall, they can spread that easily to 20 people at one time. And that's where the danger comes from, is this unvaccinated population, particularly the kids. Like I was talking about before, the kids can't get vaccinated to a certain age. And so if you look at like the first symptom that they're going to feel, usually a week or two after they contract the virus, you're talking about a high-grade fever of 105. You got to manage that fever, or there are going to be severe consequences for that child after that. It can develop into short-term things like pneumonia. Again, it's a very dangerous condition for a kid to have. Long-term, it can cause brain swelling, which can lead to deafness. It can lead to convulsions, and ultimately could lead to death. And so when we look at these things, particularly in that younger population and that vulnerable population, it is highly impactful. Also, if there's a woman who is pregnant and unvaccinated, it can lead things to preterm birth, which also is going to have complication for the children. So I would say in a big area like Houston, and you see it all over the news, the issue is where we're seeing a lot of the tracking of people who have gotten this virus. Some of them are going to concerts, some are going to sporting events, they're going to 5 or 6 different restaurants, and the real issue is they're not feeling symptoms of measles until a week or two after they get it. But in that entire time period before they're showing symptoms, they can spread this virus without even knowing they have it. So that's where the real danger comes into, is most people with 105-degree temperature are not going to go to a concert or not going to go to a game, and they're going to do the right thing and stay home and try to get better. There's a 1 to 2 week window when they get the virus that they don't even know they have it.
What do you say to people that have gone, they do feel the symptoms? And what are some of the symptoms that they see? A fever? What are some of the other symptoms, and what do they do after they seek the doctor? Or some people like to treat their, think it's just a common cold.
Yeah, so it usually starts to present itself as a high-grade fever, and then what you'll see is sometimes white spots in your mouth, or you'll start seeing dots on that start from kind of the hairline and move down and end up going from spots to kind of coming together and forming a full rash. For anyone who has these symptoms, they should go to a doctor and get tested, because one of the crucial things is management and supportive therapy, making sure the symptoms don't get worse, making sure the fever's under control, making sure you're also not spreading this to other people who might be vulnerable. That's key. So when you're talking about, call a doctor, find out before you go into that doctor that they have a test, because that's another one of the problems. Some people are having to go to 3 or 4 different doctors to find out where they can get a measles test done. Not everyone offers that. And then making sure that you're paying attention to your own health and getting the supportive therapy that you need to prevent long-term consequences of measles. This will present with a higher temperature than a normal virus. You will have more severe reactions than a normal respiratory virus. So making sure you get tested soon is going to impact the outcomes positively.
Is that vaccination just a one-time thing, or do you get it every year, like a flu shot?
It's actually twice. You get 2 doses. One usually between the ages of 12 and 18 months, and you get your second dose right around the age of 3.5, 4 years old. When you get one dose, you're generally pretty well protected from measles, but the second dose kind of reinforces that for the rest of your life. So if people have had their first 2 doses as a kid, you by and large are good and don't need to get another vaccine after that.
That was Dr. Jay Reddy, who is the Chief Science Officer at HealthTrackRx. He's a longtime healthcare and laboratory executive with a decade of experience in molecular diagnostics. The Houston Health Department is actively investigating the cases and is working to identify anyone who may have been exposed to help prevent measles from spreading. HHD urges anyone who develops symptoms of measles to contact their healthcare provider before visiting a medical facility to prevent potential exposure to others. So you need to travel to any of the domestic areas where measles has occurred. Early vaccination is available and recommended for people as young as 6 months old and with a second dose available in as little as 28 days after the first dose.